Doctors of Reddit. What was the most shocking case of I thought that was normal you've seen in a patient? When I was a medical student, a patient and his brother came in together. Patient was just a post-op visit after a hernia repair. Found out he had another baseball-sized hernia. His brother, on the other hand, had literally had a football-sized hernia visibly coming out of his left leg of his shorts. Looked like an inguinal hernia, and he was able to use it as an armrest. I asked him if that bothered him at all, and he straight up said my brother's hernias were painful but this isn't. So I thought it was just a quirky defect. I hope he was lying to save face, but we recommended he get it taken care of. This must be more common than I thought. When I was 10 years old, I had a hernia that pushed my intestines down into my balls. It looked bad, but I honestly didn't feel a thing. I told my mom right away because I'm not the sort to ignore things, and the doctor was astonished I wasn't in severe pain. They actually waited 2 months to fix it so I could finish 5th grade and have the surgery in summer because my pain was a 0. Bonus. Because of this we finally figured out about 20% of the nerves in my body don't work, which explained a lot of issues I'd had before, and we figured out I need at least triple doses of anesthetic to be put under or have pain dulled. My body is awesome, but deeply weird. MD here. A couple years back, had a walk-in complaining of a few months of abdo pain / swelling. ISU not. The man was Simpsons character yellow with jaundice and ascites, fluid filling the belly. He seemed shocked when I told him I was calling the hospital to arrange direct admission. When I was a med student we visited a clinic in the country where I studied. Lots of people would get horrible injuries and use the local elixir of dirt / motor oil / spit from the local old lady to patch up an exposed arm bone. Or whatever. Had one woman in her 20s come in with a fungating breast cancer that looked like a hard mushroom / mold growing through the skin and to the outside world. Constantly bled anytime you touched it. Her family shamed any injuries or impurities, and she thought she just needed to keep it covered until it got better. I'm making my internship, and one night I was attending a triage at a triage is the area where you check the patients and decide how urgent is the attention they need. Context here. I'm in a third world country, and I'm at a public hospital that attends uncovered population. And instead of one hospital with all the specialities we have 3. The main one, the Gyo hospital, and the children's hospital. So I had this woman of late 30s. She started telling me that she had an extreme pain, 10/10 in the lower abdomen. No other sign that food could be involved. Neither kidney stones or urine infection. I proceed to ask about last menstrual cycle. She doesn't recall the exact date, but she says that was like 4 months ago. Without hesitation and without asking more or anything else I told them, she and her familiar, to go right away to the hospital that was crossing the street. Because if it was something obstetric we didn't had any gyno in this hospital. And if it was something of general surgery they had general surgeons there. We got a call like 20 minutes later lol. That woman delivered her baby at triage of the other hospital. OBGYN here. I've pulled so many things out of vaginas that people claim they didn't know were in there or don't think it was abnormal to leave them in there. Old rotting medical devices. What looked like a plastic car wheel or bottle cap. Used condom. Old tampon. Insects. You get the drift. Nurse here. 67 years old thought she was pregnant. Gotta say, she looked pregnant in that it was all in her abdomen. Like some pregnant women who look like they're carrying a basketball when they are at the end. But she was 67. Turns out it was a 37-pound ovarian cyst. I asked if I could watch the surgery. That thing came out all in one piece. I'll never forget the sound it made. This was at a community hospital many years ago, before HIPAA. So naturally the lab announced that anyone who wanted could come down to the lab and view this incredible thing before it was dissected by pathology. The line at lunchtime was so long you'd think they were giving away free concert tickets. I don't know if this fits, but here's a story about my husband. We were messing around, and he chased me through the kitchen. Took a hard left turn and lost his footing. Fell on his side. He's a big dude, so falling is a bit more traumatic for him. He couldn't put pressure on his leg and knew immediately he was hurt pretty bad. He was able to crawl to the couch and once settled, said he wasn't in too much pain. He decided to sleep on the couch that night so he wouldn't have to go upstairs. We made an appointment in the morning for the so we wouldn't have to sit there all day, but they didn't have an opening until 2. So we just hung out at the house. He was in a decent amount of ambient pain, but it didn't seem emergent. Once we got to the hospital, we find out that he had broken his hip, in this case breaking off his entire ball joint from the top of his femur. The nurses said they couldn't believe that he was able to sit up and had slept on it, implying that we should have come the night before and probably by ambulance. It required surgery with some hefty bolts to put it back into place. But the crazy part is that apparently a healthy 30-ish-year-old man breaking his femur from standing is highly unusual. After several tests and an MRI, it turned out he was in the early stages of osteoporosis due to a pituitary tumor in his brain. So we discovered a benign brain tumor all because dude was wearing slippery socks. Not a doctor, but related story of major illness undetected. My son, 13-yo, complained to me that his scrotum was unbearably itchy. I figured probably sweat. Told him to wash the area thoroughly and make sure to dry well. Maybe dust some baby powder on there too. A couple of days later he said it was still itchy and getting bigger. Bigger? He showed me his visibly swollen scrotum. No pain or anything, just itchy and swollen. So that's not good, but I didn't think it was anything more than a sweat rash that maybe needed some ointment. We go to the doctor and are sent off for an ultrasound. The scan shows zero blood flow to the area. Immediate transfer to the emergency room. He goes in for emergency surgery, where the urologist surgeon removes one necrotic testicle. It had become randomly twisted, testicular torsion, and died. At least a week prior according to its necrotic state. The swelling was a major infection setting in. The itchiness was caused by the infection and skin stretching. He had no pain whatsoever, and the doctor said that was amazing. For most boys, torsion feels like being kicked in the nuts continuously, and by the infected stage he was indeed expect crying and screaming level of pain. Much longer and he could have developed sepsis. We just thought it was a bit of a rash that got out of hand, and are lucky I took him to the GP and didn't just go buy ointment OTC as I had thought of doing. He had a follow-up surgery a month later to insert a fake testicle and to stitch his remaining live testicle to the scrotum wall so it can't commit seppuku like its brother. Emergency room MD here. Had a patient come in for cast removal literally years after it had been put on. She had just decided it wasn't worth taking off. Her leg skin was literally growing over the top of the cast and then down it. Once we finally cut the cast off, she was surprised to find that she had no skin underneath, but the dead tissue over her muscles and bones was being cleaned by about 300 maggots. I knew by the smell that something under there wasn't right, but wasn't expecting that. Patient seemed completely fine with it. Whatever. I've got tons more of these stories. That was just the first one that came to mind. Patient with cancer, SCC, of their finger. It ate the entire fingernail, the nail bed, tip of the finger. Probably a year of growth. Eventually got them to let me see under their band-aid at the cut that wouldn't heal. They had no fingernail. Had to scrape the bone BC, the cancer grew so deep. Resident doctor here. Although not an OB/GYN. In my OB/GYN rotation in medical school, I had a patient who was a first-time mother having difficulty nursing her baby. The patient said she had some redness and it had been hurting to nurse on one nipple, so she often had to switch until finally it became unbearable for her to nurse from either. She had mentioned that she thought her nipples might be cracked or chafed. When it finally came to the exam, she had the most chafed nipples I had ever seen. It looked totally raw and macerated to the point that they looked like two large pepperoni slices. One of her breasts also looked like the wound had led to mastitis. It definitely led to a new appreciation of how difficult breastfeeding can be on new mothers. This one was actually from back when I was a medical student, but it's still the weirdest thing I've seen. Sorry this is long, but I promise it's worth it. It was my last rotation of medical school before graduating and starting residency. I had completed all my requirements and just wanted to take a few interesting electives of things I hadn't seen yet. This was a dermatology rotation at the VAP. The rotation had been interesting and chill. And it was my last day. And my third to last patient as a medical student. The guy came in. And the resident asked him why he was there. And he said, I have hair coming out of my hand. I figured he meant a weird mole with some hair coming out. But this guy, probably late 30s or early 40s, says no. The hair is coming out from under the skin. The resident asked what he does for a living. And he says he's a barber. The resident tells me that it's not too uncommon for hair to poke through the skin. Especially for barbers who cut men's hair. It's short, thin, and can be kinda pokey after all. And it was sort of like getting a sliver, but with hair. But the guy says, no, it's a lot of hair, look. And he holds up his hand, making a fist. And there's several hairs poking out from between the knuckles of his pointer and middle finger. I stare in confusion. And the derm resident grabs some tweezers and pulls out a tweezer full, maybe a half dozen, of short black hairs. The guy says, yeah, I already pulled out like 50. The derm resident was like 50, so the derm resident numbs up the backside of his hand between the first and second knuckle, and makes a little incision, and starts pulling out gobs of short black hair. Chunk of 20, chunk of 30, etc. And now she's got the magnifying glasses on and the attached light and she like, oh my gosh, there's still more in there. Sir, do you know how all this hair got into your hand? And the guy goes, oh, it probably came in through there. And he flips his hand over to reveal a hole in the palmar aspect of his hand skin. Turns out the dude had cut himself like 2 years before this. And it had never healed properly. He was diabetic. And he just kept cutting hair with this open wound on his hand. And probably every day a few hairs got stuck in his hand. For 2 years. And now those hairs had tunneled through the webbing between his first and second fingers from the front of his hand. And out the backside. Long story already, sorry. The poor resident spent like 30 minutes milking his hand and fingers while more and more hair came out. She said, there's no way I got it all out. You have to come back every 2 weeks for a few months for us to keep removing more hair from your hand. Which is a weird sentence. In the meantime, wear gloves while you cut hair. We gave the dude a whole box of latex gloves. I don't remember anything about my last 2 patients that day. It was literally my last day as a med student. And boy, what a way to go out. Still probably the weirdest thing I've ever seen. Not to mention how there's some hair in my hand. Happens, I guess the guy was about it. Edit. Also, yes, this is 100% real. I would be proud if I could make something this weird up. The other question was if the resident did anything to address the poorly healed wound in the guy's palm. Unfortunately, I don't remember the resident addressing this, but it was several years ago, so maybe she did. I was pretty shocked by the whole thing, so my memory may not be 100% reliable. I suspect a few stitches on some dermaband cold at least closed it temporarily as it wasn't that big, couple centimeters. But I don't remember her doing that on this visit. And I graduated. So I never saw this patient again. I imagine it was addressed in subsequent visits. Edit 2. Clarification on the palmar hand wound. I described it poorly above. So hopefully this will clarify. He appeared to have cut himself deeply a few years ago. Perhaps 3 to 5 centimeters. But through the entire skin. In process of healing. Remember, diabetics heal more slowly. Especially in distal portions like hands and feet. The wound had healed such that the edges never came back together, effectively leaving a small, few centimeters, slit in his hand. So maybe saying open wound was incorrect on my part. More like an acquired dermal defect. A slit, though all skin layers. Small enough that anything of substantial size would never get through. But large enough for hair to easily slip through. It was not draining or bleeding, red or swollen, but clearly open, meaning allowing free access to the internal environment. It was probably 3-4 cm x 0, 25 to 0, 5 cm, narrower at the edges, wider in the middle, so a wide slit. MD here. Patient came in saying he was feeling a little tired and noticed he was having a harder time doing his job in construction, a particularly difficult type of construction. Turns out he had slowly lost 80% of his blood over the course of a few months. Dude was a badass to be working as hard and long as he was with only a fifth of normal blood volume. Hemoglobin was low 2s.